Sometimes science fiction becomes science fact a lot faster than we think. The noted author Michael Crichton had it nailed back in 1972. His book was called The Terminal Man, and it was about a man who suffered blackouts because of epilepsy. So the doctors tried an experiment. They implanted electrodes in his brain, which would allow him to deal with the seizures and hopefully then prevent them from happening. And as in most science fiction, the end result was not as intended, of course, either in the book or in the movie. But Crichton was decades ahead of reality with his idea, bringing us to the present and the possibility of something similar being used to stop the violent shakes from Parkinson's disease, and then perhaps even more. Recently on MidPoint, we spoke to neurologist and director of the Comprehensive Movement Disorder Center at the Palm Beach Neuroscience Institute in Florida, Dr. Arif Dalvi, and we talked about if indeed science fiction was close to getting the idea right.
Very much so. I think, this technique, it is called deep brain stimulation, which involves putting an electrode in the brain. This has been used for tremor disorders and Parkinson's disease for quite a while, but more and more indications are being looked at in an experimental way. So epilepsy, which the book talked about, is actually been looked at seriously as an indication for this device as well. And there are other areas, including psychiatric disorders like depression, and very interestingly, small early work being done in the area of obesity as well. So it's very promising technology.
Now, this is not new. As you told me, this has been going on for 10 years, but the whole thing is not necessarily that you've got it, but the technology is improving, and then the targets are improving in the brain, correct?
Correct. When we started out for tremor disorders, there was one single target in the brain. It's called the thalamus, which is an area in the brain that where the tremor cells are found. But as time has gone on, we have found new targets for Parkinson's disease, the subthalamic nucleus, the globus pallidus, and there are other very specific targets in the brain that if you put the electrode in there, it corrects the abnormal electrical signaling, and that allows us to return the patient to a more normal state, whether it is tremor or other symptoms.
Now, in the book, I hate to go back to it, but it was so brilliant the way it was done, and Crichton was so brilliant in the way he wrote this book. It was that the patient could then sense something coming on. He could sense a movement, a seizure, and he could stop it in his brain. Now, are we talking about something like that people could eventually feel something and then stop it?
Well, with a lot of seizures, patients do get what is called as an aura. So they may feel a funny sensation in their stomach. They may smell a smell of oranges, for example, is a classic description. If the patient senses that and they are able to trigger the device, it would help abort the seizure. Even more so, the next wave of technology in terms of seizures, which again is experimental, but they're looking to see the device itself will sense the seizure coming on and will stimulate the brain in such a way that aborts the seizure.
What you're talking about is brilliant. It is science fiction in many ways, but it's not. It's science fact now because you do it. But it sounds like it has an element of danger, because you could get a patient who gets used to it, who then uses it. It could be used almost for a pleasure stimulation in many ways. Is there any way? I know I'm probably going way over the edge, but there's always that possibility.
It will not work for pleasure simply because the target that is being used is not a pleasure center.
The target cells, the
Correct.
area of the brain.
Correct. Now, on the other hand, as I mentioned with obesity, there's an area in the brain that makes us feel full or satisfied, and that is what we are targeting with the stimulation. So, it really depends on where the contact point, where the electrode is in the brain, and you can elicit different results from it.
How many targets do you have? I know this is probably a guess, but how many targets have you already identified in the brain?
Right now, the three main ones are the thalamus for tremor, the globus pallidus for involuntary movements called dyskinesias in Parkinson's disease, and the subthalamic nucleus for overall symptoms of Parkinson's disease. These are the most common ones, but as I said, more and more are being looked at.
Is this something, you've been doing this for 10 years, is this something now that people can use right now?
Absolutely. This is no more experimental technology. It's FDA-approved technology, and especially for Parkinson's disease, in a well-chosen patient, it can have dramatic results.
But we should point out, too, that you go through a lot of tests with an individual patient, making sure that what you're about to do to them works for them. It doesn't work for everybody, I would guess.
It does not. You have to carefully select the patient. So in my own practice, I will put them through a standardized rating scale, the UPDRS scale, that really covers their symptomatology in a comprehensive way. And we also want to make sure they don't have contraindications such as dementia that would basically mean that the surgery will not help them as much. But in the right sort of patient, it can be a life-changing treatment. Now, having said that, there's about a 2% risk of bleeding in the brain, because when you're putting electrodes in the brain, it can rupture a blood vessel, and that can cause blood to leak out into the brain.
I've only got 20 seconds left. I hate to use it, but is this possibly a cure?
It's not a cure, but it's probably the best way of looking at it is it's a way of setting the clock back on the disease by 5 years, 7 years, if the patient is lucky, even 10 years.
And if patients are getting treated by their doctor, if they don't know about it, they should ask about this?
They should, or they should contact us at Palm Beach Neuroscience Institute. pbni.com is the easiest way to get a hold of us.
Here's something else. I did a little reading on this. There was a patient who was in a coma for 6 years, and they then hooked him up to deep brain stimulation. They worked it for 6 months, 30 days on and 30 days off with the stimulation. Again, 6 years in a coma. They actually were able to recover voluntary movement in one limb of the patient, and there was some movement, and the patient lasted about 6 years, and they continued the research. So even in a coma, the stimulation was able to find some part of the brain and get it back moving again. It's fascinating, and it's not even science fiction at this point, it's science fact. Talk about science fiction. What do you think when I say the name Roswell? Next on MidPoint.